I know the question was asked a few days ago. Is that data available?
The data is being garnered, and it's a fluid process, but we don't have that data. But we should have that data available in the coming days. I don't have it now.
Do we know anything about how long people are incubating the disease? So from exposure to onset of symptoms?
I'll have Dr. Swine address that.
Right. Dr. Swine, I'm the medical director for the Public Health Department. And actually, we spoke with the CDC about that exact question this morning. And they're noticing a kind of two peaks in terms of the incubation period. There's a 1-day peak and there's a 4 to 5 day peak. So to remind people, the incubation period is the time between exposure and the onset of symptoms. And what the CDC is thinking is that the real incubation period is around 4 to 5 days, and that this 1-day peak that they're seeing actually constitutes concomitant exposure to a single source with several people whose onset just happened to occur 1 day apart. So it really looks like the incubation period about 4 to 5 days. And then also to remind people that the way things look right now, people should be considered to be infectious for at least 7 days after their onset of symptoms and to at least 24 hours after those symptoms resolve. So a minimum of 7 days and maybe more if the symptoms persist longer than 7 days.
So symptoms can last 7 days?
Well, they can last longer than 7 days. They can last shorter or longer. Okay. But the infectious period will be a minimum of 7 days from symptom onset and maybe longer if the symptoms last longer.
Now that the caseloads are continuing to increase, what are you guys saying now in terms of large gatherings? People have church gatherings and things like that tomorrow. What are you communicating to folks now that they're off on the weekend and perhaps gathering in large
Our recommendations remain the same. We ask individuals in our community to use good common sense in terms of avoiding individuals who are exhibiting symptoms of cough or flu-like symptoms. If they themselves are ill, to avoid those venues. We have no guidance toward the cancellation of large social gatherings. We have no restrictions regarding that. Our advice is in terms of good hygiene and to have the normal social distancing that would come along with when you encounter someone who is exhibiting those symptoms. That 6 feet window when someone is coughing and exhibiting those symptoms is what we would refer back to. But there's been no recommendation to cancel, restrict, or restrain anyone from social gatherings. That would include churches, ball games, and any other large social gathering.
The state says that of the people that they've been tested, 92% have come back negative. Can you give us a figure, I guess, on how it looks like in the city right now?
Well, the state level of hygiene is having data from everyone's. I would believe that from our own reference lab here, our laboratory, that we're seeing similar volumes, but I would have to have either Dr. Swing or Paul come
address part of that. So in terms of concurrent illness occurring in the community, we're learning that seasonal influenza is still being picked up in the community, both type A and B. So this is, again, remnants of our past seasonal influenza epidemic. In addition, there's many other types of respiratory infection that are co-circulating as well, which is somewhat confounding some of the data. But I don't have the exact percentages for our lab in terms of which are other respiratory diseases, such as type A and type B seasonal influenza versus other types of respiratory infection. I fully second everything that Paul just said, and I would add one more thing, which is that the difference is that we are used to these other infections. We're used to regular seasonal flu. We're used to RSV. We're used to all these other viral illnesses. But this swine flu is a new virus. And it's still very early in this outbreak to tell precisely how it is acting and how it's going to act. So just because there's a lot of different other illnesses going on does not in any way diminish the importance of being careful about this virus.
I'll take one more question.
Mr. Brady, you said very early that you have seen no signs of this slowing down at this point. Should parents, should people out there expect additional school closings? Is this going to get worse before it gets better, in your opinion?
Well, certainly parents and our community at large should expect more cases. We will probably be updating in a frequent fashion more cases. We will take into consideration our discussions today with the Centers of Disease Control and the Wisconsin Division of Public Health, what is translating in terms of severity of illness. And if the science leads us along with a reasonable reliability of our recommendation to closures, we will make this on a case-by-case basis. But that advice will come later tomorrow. We have quite a bit of data to look at, and quite a few discussions. We will work around the clock, and we will address school closures tomorrow. This is something that we want to make certain that we're correct and we're conservative, but we also want to look at how this affects our entire community, and that is in terms of families, in terms of commerce, in terms of businesses, but safety and public's health come first.
Thank you.
Yeah, thanks.